So you heard a lot this morning about new developments in care and advancements, and I am one who absolutely believes that we will see a fundamental redefinition of primary care access and perhaps specialty access going forward based upon the opportunity to deliver a lower cost product almost on demand going forward. And this, again, could be viewed as a threat or a real opportunity to organizations as you think about your own strategies. So about 2 weeks ago, I served on a panel discussion for the American Hospital Association at their annual Society of Healthcare Strategy and Market Development conference in San Diego. And one of my fellow panelists was this chief medical officer from Teladoc, a guy named Henry DePhillips. And Henry talked about the progress that Teladoc is making in this space, and the announcement this morning about the Castlight partnership is just another example of this. But Teladoc is started with a clear focus just on primary care, but they're now starting to expand into specialty care services as well based upon the receptivity of the market. And their primary target right now in terms of partnerships is with payers. So they're going to the payers and saying, we can offer an access point that will cover 40, 50% of primary care interactions at a much lower cost to your enrollee population than what they would experience if they go even to a Walmart or a Walgreens or their physician offices or an urgent care center or, God forbid, an emergency room. Teladoc just is about to surpass their 1 millionth visit in primary care online interactions. Just one example of a new delivery capability that is out there. I happened to do some work with Kaiser and have some interaction with Kaiser over the last couple of months. They're moving very aggressively toward virtual visits as the basis of primary care interaction as well. Roughly 20% right now of all Kaiser primary care visits are completed on a virtual basis, largely over mobile devices. Again, this could be viewed as a big threat because of the platform that we need to create and the different way we need to organize our care delivery models to interrelate to consumers on a virtual basis. But it also could be a tremendous opportunity. And it could, given that we can break down, and this is a given that we'll need to overcome it, if we can break down some of the regulatory barriers that are in place both within the country, across states, but more importantly, perhaps globally, you could be providing, opening up your organization to entire new markets, worldwide global markets. Why couldn't an interventional cardiologist at Northwestern here in Chicago or at Rush or any of the Loyola, any of the other major academic medical centers create a platform where their specialists now could be accessible to referring physicians, primary care physicians, as well as individuals on a global basis? I mean, that opportunity would seem transparent and obvious and likely be more of a cash kind of business going forward than an insurance-based business. The collection of that patient visit could be made right up front with credit cards, so you don't have all the issues of on the back end going after these individuals to try to collect care. But it provides access to a level of sophistication of care delivery that an individual in Peru probably would have never had access to without this kind of new capability and technology. So, if we really open up our minds to different ways of delivering care and serving different markets, I think this whole migration toward retail concepts and principles could be very compelling and exciting for the market.